I've seen a lot of football games here.
Been to a lot of football games.
For 4 years, I was the team ophthalmologist for the Arizona Cardinals. Took care of their physical examinations prior to the season, would examine the new drafted players after I retired. I think the Cardinals were looking for somebody who had a comprehensive view of ophthalmology and could take care of traumatic injuries to the front of the eye. And I think that Dr. Petelin was a logical choice because of his fellowship training and the fact that he was interested in sports and in football in particular.
When the Arizona Cardinals came to me a couple of years ago, I was flattered and I was chosen by them to be their team ophthalmologist, and their organization is really phenomenal. The players have been great. Being involved with the team is something that I never imagined. It's been amazing how many players have been able to get as far as they have in their professional career, really not seeing well. To be able to kind of give that to them has been a real thrill, and we've done that several times, and this year was no exception. I wanted to build a facility that really merged the best of both worlds with respect to LASIK and refractive surgery, and then where things were headed in cataract and lens-based surgery. And those two have really kind of come together in the last decade or so. And I think Center for Sight, I think we've always been kind of on the cutting edge with those things. I mean, we were the second practice in the state to get interlaced back in 2005. You know, I was one of the first surgeons in the city to do some of the premium lenses that are very common these days. And so I feel like our experience is unique. We've always kind of been right there at the beginning of a lot of neat trends that have maintained themselves over the last decade. Yeah, with the addition of Dr. Shorb, we've added probably the single greatest growth area in ophthalmology has been some of the treatments that we now have for macular degeneration and for specific conditions that affect the retina.
One of the reasons that I chose to come up to Scottsdale and join Dr. Petelin was that he had done a fellowship in corneal disease and refractive surgery, and I had done a fellowship in retinal surgery. And the two areas complement one another very well.
Other physicians refer in the Scottsdale Center for Sight, well, I think largely because we do have kind of a niche area of expertise. Obviously, we do laser-based refractive surgical procedures, but we do much more than that. You know, I'm a cornea specialist and I do cornea transplant surgery. I have a very stable cataract practice, and so we do a lot of anterior segment work. And I think practices that have a more broad view are attractive to referring docs because they don't just do one thing.
It's always gratifying to have patients refer their relatives and friends to me because that's a sign of confidence that we're doing the right thing for them. And it's certainly, when we do get referrals from other physicians, it's a feedback that we are doing the right thing.
When patients are choosing a facility or surgeon for surgery, I think they need to be aware of exactly who's going to be doing their surgery. They need to understand who's going to be taking care of them in the post-operative period. A lot of practices, it's not the surgeon that's doing their surgery. At our practice, it's me. I think they really need to understand exactly what's being offered because there's a big difference in technology. So those are probably the most important things. I think there's a lot of surgeon experience these days. LASIK has been around for 15 years, and obviously I think it goes without saying choosing a surgeon that has a significant amount of experience isn't automatic. But the smaller things are important too, and knowing the practice that you're getting involved with I think is a key thing.